Welcome to this comprehensive video about insulin pump settings. An insulin pump offers an intricate way to deliver insulin. It allows you to control both your basal and bolus insulin levels with only short-acting insulin. In this discussion, we'll explore the various settings and how to set basal and bolus insulin settings as you switch from insulin pens to a pump. It's important to note that most guidelines about insulin pump settings are opinion-based, and that these videos are not intended as medical advice. Always consult with your healthcare provider before changing your treatment. 1. Overview of insulin settings. In an insulin pump, you can adjust basal insulin delivery for each half-hour or hour-long segment throughout your day. In most pumps, you can set up multiple different basic profiles to select from. There's also a feature to choose a temporary basal rate, which allows you to adjust your insulin release for a specific period of time. You can also stop or suspend your insulin pump at any time. However, be cautious about stopping the pump for longer than 2 hours, as it could lead to ketoacidosis. As for bolus insulin, the pump gives 2 options. A manual bolus, which lets you determine the insulin amount you want to administer, and a bolus from the bolus calculator, which computes the necessary insulin based on your carbohydrate intake, blood sugar level, carbohydrate ratio, insulin sensitivity, target value, and active insulin. Furthermore, you can choose among various types of boluses like a simple bolus, an extended bolus, or combined bolus that could be particularly useful for meals high in fat. 2. Basal insulin rate. Most individuals with type 1 diabetes using insulin pens follow a basal bolus regimen. This consists of 1 or 2 injections of long-acting insulin and 3 or more injections of rapid-acting insulin for mealtime carbohydrate intake. In transitioning to an insulin pump, we generally calculate the total daily insulin dose by making the sum of both long and short-acting insulin and set the pump to deliver 80% of this total daily insulin dose. This reduced dose is because the insulin seems to work more efficiently via the pump, and we want to avoid hypoglycemia. As an example, let's consider Anne, who has type 1 diabetes. Every day, she injects 45 units of Lantus before bed, and on average, she has a total of 30 units of Novorapid with her meals. That's 75 units in total. If she switches to an insulin pump, she'll need to reduce her total daily insulin dose to 60 units. This insulin amount is then divided into doses of basal and bolus insulin to be given by the insulin pump. For most people, the starting ratio of basal to bolus is about 50 by 50%, but it can vary depending on individual dietary habits. This means that the basal daily insulin dose will be half of the previously calculated total daily insulin dose. Now that you know the total basal insulin dose, you can divide that by 24 and set that as a fixed hourly rate. In our previous example, we determined that Anne's total daily insulin requirement would be 60 units when switching to an insulin pump. From this, her total basal insulin need can be calculated to be 30 units per day. By dividing this amount by 24 hours, we arrive at a calculated basal insulin rate of 1.25 units per hour. Most healthcare providers are accustomed to further fine-tuning the basal rate to align with the circadian insulin needs of their patients. For manual insulin pumps, it is common practice to set a lower basal insulin rate at night, for example 20% lower, and a higher basal rate during the day to better match the body's varying insulin requirements. For people with known dawn phenomenon, a higher basal rate can be set between, say, 2 a.m. and 7 a.m. To evaluate basal insulin, you can monitor blood sugar levels. This can be done either with finger sticks or a glucose sensor, but using a glucose sensor makes the process easier. At night, this is relatively straightforward, as no additional factors like eating or exercising affect your blood sugar. During the day, it's a little more complex. One way is to occasionally skip or delay a meal for a few hours and see if there's a persistent change in blood sugar levels. A rise or fall of more than 30 mg per deciliter or 1.7 millimol per liter may indicate a need for basal insulin adjustment. 3. Bolus calculator parameters. Once the basal rates are set, the bolus calculator parameters can also be defined. Bolus calculator parameters include the carbohydrate ratio, insulin sensitivity, also called correction factor, bolus calculator target value, and duration of insulin action. We'll discuss them one by one. Let's dive into insulin to carbohydrate ratio. The insulin to carbohydrate ratio, or carb ratio, is the quantity of carbohydrates that can be covered by 1 unit of insulin. To determine the amount of insulin to bolus for a set amount of carbs, patients need to count their carbohydrate intake during meals and then divide it by the calculated carb ratio. For example, if you're going to eat 50 grams of carbs and your carb ratio is 5 grams per unit, you will need to bolus 10 units of insulin. The carb ratio can be established in a few ways: by employing the 450 rule through a dietitian who calculates the carbohydrate intake per meal and then divides it by the amount of insulin units injected, or by taking a certain percentage of the total daily insulin dose. The 450 rule means that you can divide 450 by the total daily insulin dose to calculate the carb ratio. For example, if Anne's total daily insulin dose was 60 units and using the 450 rule, her carbohydrate ratio would be 7.5 grams per unit. Hence, for a meal of 15 grams, she would need 2 units of insulin. Alternatively, some healthcare providers use the 300 to 500 rule to calculate the carb ratio. Another method involves a dietitian calculating the actual carbohydrate intake, which is then divided by the units of insulin injected. Lastly, one can take a certain percentage of the total daily dose for meal boluses. In the case of fixed portion meals, it is typically recommended to use 50% of the total daily insulin dose for all meals. Given that more insulin is usually required during breakfast, it can be divided as follows: 20% for breakfast, 15% for lunch, and 15% for dinner. To evaluate the carbohydrate ratio, check the blood sugar level 3 to 5 hours after an insulin bolus. It should return to pre-meal levels. If it is consistently higher or lower, consider adjusting the carbohydrate ratio by 10%. The second parameter for the bolus calculator is insulin sensitivity. This reflects the amount the blood sugar level drops per unit of insulin, measured in milligram per deciliter or millimole per liter. The 1800 rule for milligram per deciliter or 100 rule for millimole per liter is commonly used, but a more aggressive setting could be the 1500 rule or 90 rule, and a less aggressive setting might be the 2000 rule or 120 to even 130 rule. Take Anne's case, for example. With a total daily insulin dose of 60 units, her insulin sensitivity can be calculated using the 1800 rule if you use milligram per deciliter. 1800 divided by 60 equals 30. Therefore, setting the insulin sensitivity to 30 mg per deciliter per unit means that a unit of insulin will decrease the blood sugar level by 30 mg per deciliter. The bolus calculator also requires a glucose target, which could be a fixed number or a target range. Depending on the type of insulin pump, the bolus calculator may use the target value differently. Most pumps will correct to the middle of the target range. Some pumps, like the Omnipod Dash, also have a correct above value, indicating when a correction will be applied. Some pumps also offer an option for reverse correction, subtracting insulin if the current blood sugar level is lower than the target. It is generally recommended to set a fixed target value or a target range of 90 to 100 mg per deciliter, 5 to 5.5 millimole per liter. However, this should be individualized. Lastly, you need to set the duration of insulin action. This parameter determines how long the insulin stays active and thus how much of the previous insulin bolus is still in effect. To avoid insulin stacking, it's crucial for the pump to take this into account. Typically, this is set to 3 to 5 hours. So now you understand how to set the basal insulin and the parameters for the bolus calculator. 4 do's and don'ts. On the first day of using an insulin pump, basal insulin from the insulin pens may still be present. It is recommended to inject only half the long-acting insulin the day before starting the pump. For users of Toujeo or Tresiba, it may be best to switch to Lantus a week in advance due to its shorter action profile. If unsure, it's safer to reduce the basal insulin rate when starting the insulin pump to prevent hypoglycemia. When starting on an insulin pump, it's usually necessary to set a limit for insulin delivery, for example, the maximum basal and maximum bolus. Typically, it's recommended that the maximum basal insulin delivery should be double the highest set basal insulin delivery, and the maximum bolus should be the largest bolus expected for a large meal. All insulin pumps allow users to set various profiles for different situations. The number of basal profiles that can be set varies depending on the pump. Pumps only store the basal insulin in a profile, while others, like the tandem pumps, also allow adjustment of the carbohydrate ratio and insulin sensitivity per profile. There are also several strategies for adjusting your insulin needs with temporary basal rates. They should be evaluated individually. In some cases, you could consider a temporary higher basal rate. For instance, a 50% higher basal rate for 8 hours after eating a high-fat meal, an 80% higher basal rate for when you're ill, a 50% higher basal rate 3 to 6 hours after receiving a corticosteroid injection, an 80% higher basal rate from 1 to 2 hours before a scheduled stressful event, a 40% higher basal rate during prolonged inactivity, like a long car ride. Other examples of temporary basal rates are a 50% higher basal rate in the week before your menstruation. Some people also set a 30% lower basal rate during their menstruation. In other cases, you can consider a lower temporary basal rate, for instance, a 50% lower basal rate from 1 to 2 hours before extensive activity like housework or yard work, a 30% lower basal rate for 6 to 10 hours after exercise to prevent late-onset hypoglycemia, or a 40% lower basal rate after consuming alcohol for 2 hours per drink. Lastly, remember to constantly monitor your blood sugar level. The insulin pump's primary advantage is the precision and customization it offers. To make the most of it, you should adjust settings based on the observed patterns. You may also need to tweak these settings frequently, at least in the beginning, to achieve optimal glucose control. Remember that every person is different, and while these guidelines may apply to many, there's no one-size-fits-all solution in diabetes management. It requires personal fine-tuning and learning by trial and error under the supervision of your healthcare provider. Keep in mind that while insulin pumps can make management easier and more precise, they also require a deeper understanding and commitment to managing your diabetes. In some ways, it can be more demanding because of the necessary knowledge and continual adjustments. We hope this presentation has provided you with some valuable insights about transitioning from insulin pens to an insulin pump. We encourage you to reach out to your healthcare team for further support and guidance during this transition.